Yeah,
Yes,
we
go
can see it very
ahead.
well.
All right. So I was still trying to recap what we learned the other time, the difference between monitoring and then evaluation, saying that monitoring will take place from the word go from the project or program initiation throughout the program. And then evaluation can come in uh, at periodically or at the end of the program to see whether the program has achieved its objectives or not. So monitoring per se really enables us to rectify issues to do with a program so that it is not too late for us to do that. Okay. Then we also looked at how we can get data that will help us in monitoring and evaluation. We also looked at a few things like a few keywords like indicators. Then we also looked at differences between. We also looked at differences between monitoring and evaluation in detail, where you can get data from so as to conduct good monitoring and evaluation, and a couple of things that we looked at in the last lecture, which was recorded, and you can get the notes already on YouTube. So today we are going to go a bit deeper, not so much deep, but a bit deeper, and we are going to see how a program is really structured from the word after you've put in place, after you've decided that you're going to put in place this program of, say, nutrition or sanitation. How are you going to craft it? So we have things like the mission, the goals, the objectives, activities, inputs, outputs, impact. And today we want to see how these link with each other. So before I can go on, I wanted to show us this illustration. Are you still seeing my screen?
Yes.
Are you able to see that results chain or logical model?
No. For me, it is a program story.
Okay. Yeah, so but now you can see, okay? The results chain or logical model.
Yes. Yes.
Yes. So
Yes.
this basically shouldn't put you on a lot of pressure, and you shouldn't be worried about all these diagrams. But it is generally to show us how our program is crafted or how our program components flow. So we have things like the input, what you're going to use to create these activities in a program. For example, if it is nutrition and you're going to do health education talks, so health education will be the activity, or educating people about good nutrition will be the activity. But that activity cannot take place without inputs. Inputs like the budget itself or the funding will be an input. Input like a trainer to do this health education talk. Then IEC materials, which are information and education and communication materials like flip charts, all those are going to be in inputs. And then the activity will be now health education. So from health education, you need now a short-term goal, which is called an output. So there you will have, from that activity of health education, you will have people who are educated. So after they have been educated, then another mid-term goal, which in this case we are calling the outcome, we expect behavior change. After the education, we expect something like behavior change from eating in a eating eating maybe an unbalanced diet, or eating non-nutritious food, to eating better nutritious food. So that behavior change can come in the midterm, or what we are calling the outcome. Then from the outcome, we go to impact, which is more of a long-term effect. And of course, when they change from eating non-nutritious food to nutritious food, in the long term, their nutrition status will be better. So that is something that I wanted to highlight because it will enable us appreciate what we are going to be talking about in this session. So that was it. And now we can go on with our presentation for today. So we want to look at how these things flow with each other, and we are defining all this, which we are calling the program theory, as one that demonstrates the relationship between the mission, the goals, the objectives, and activities in a given program. So, of course, the mission will be the bigger thing, and the goal will also be a bit bigger. Now you have to narrow it down to see those specific activities that will lead you there. Okay, if you want to achieve a better nutrition status in a given population, then you have to narrow it down to those activities, the specific activities, and then the short term goals that you're going to achieve. From the short term, you go to the mid term, and then the long term will finally appear. So basically, this logic model might not be very clear, but it just explains what we talked about earlier on in that uh, uh, result chain, or this logic model thing that I showed you in the beginning. And it basically shows that the resources will lead you to program activities. And in the other case, the resources were being replaced by inputs. So you can say inputs or resources. From resources, you go to program activities, and it's from the activities that you get outputs, all those short-term goals. From the short-term goals, you can now go to the outcomes, which will be mid-term, and then from the mid-term, from the output, then you have the impact or the long-term goal. So this is basically reflecting on what we saw earlier on. So the components of a logic model, all this that will enable us to link the activities, the inputs, the outputs, the impact, and then the goal, include the following, and we have seen them in the other pictorial that I showed at the beginning. We have resources, we have program activities, outputs, outcomes, the program goal, and the public health goal. So this is basically what we have just talked about. We begin with the resources, the trainers, and what have you. Then the program activities. From the trainers, you will have health education. From the health education, now you will have an output of that education taking place, because you can in an activity, it will be the individuals who are health educated. So in the output is that health education taking place, and then the outcome will now be the out will be the result of that health education, which in our case we call behavior change. Then the program goal in that case can be, after that that health education talk and people have changed behavior, then we expect improved nutrition status. Nutrition status improving in the public health goal, which is now the biggest thing, we will have better health in the population. So basically, those are the components of this logic model, and it is basically to show us the relationship between the mission, the goals, the objectives, activities in a given program. And as an M&E specialist, you need this model. You need this model because it will help you to plan how to go about with your activities, and how they will eventually lead to achievement of your goals and objectives. But also it helps you to monitor whether and be accountable whether the things are going on as planned. Okay, so we shall realize that the advantages of this is that provides information on the crucial elements of the program, which are these ones here: the resources, the program activities, outputs, outcomes, and then the goal. Then it shows that relationship as talked about earlier. Then through this logic model, we are able to appreciate first the stakeholders that are needed. Could be the target population or their representatives, and also we are able to appreciate the people that we need on our project, especially those people who are going to work. In our example, we mentioned trainers, so you cannot think about these trainers without having this logic model, because without drawing it, you might forget some of these stakeholders that are needed. But also, a well-crafted logic model, like the one that I showed you earlier, will be easily understood by all the stakeholders. The stakeholders that we are looking at here could be you yourself, who is going to implement or put in place this program, and then the workers or the people around you or your team. Then we have the government officials who also have a stake, because this project or program is not going to take place in the air. It is going to take place in maybe a district, in a region, and of course this region already has government structures, so they need to also be there as stakeholders. You have other support NGOs, you have private businesses which could also want to support you. So all these stakeholders, and then the most important one being like our target population or their representatives. So you need to bring them together, and they can easily understand the nitty-gritties of your program if you show them this logic model. Then again, we talked about it being a management tool, basically helping in planning, monitoring, and evaluation of the project. So we can always go back to this model whenever we are evaluating the success of our program, whenever we are monitoring the program progress. So when we have done all this, we need to reach a point of evaluating the success. And when we are evaluating the success of our program, of course, there are those questions that we ask ourselves, okay, which we are calling evaluation questions. And again, here you need to involve all the stakeholders. Do not leave any stakeholder do not leave them out whenever you're doing anything that is very vital for the success of the program. Whether it is evaluation, whether it is monitoring, involve them, because that they could be having input that you might not know, okay? So they need to be involved, and then the evaluation question will determine the nature of the research design or the data collection methods that you are going to use to evaluate the success of your program. So the questions should be clear, they should be linked to the program. You cannot now be talking about stunting and then you start asking about diabetes, okay? Yes, diabetes is related to nutrition, but in this case, the program is really about stunting, okay, and in children. So when you talk about now diabetes, it might be off topic. So it should be linked to the program. It should be linked to the indicators that you are going to use to measure success or failure. Then it should incorporate the needs of the stakeholders. All the stakeholders should be catered for when you're setting these evaluation questions, and that is why you need to involve them. Then it should also be based on the logic model, and we are going to see how to do that, how to make sure that your evaluation questions or the questions that you are going to ask to ascertain whether your program really worked or did not. These are the ones that we are calling evaluation questions, and we say that they should be based on the logic model. Like you should ask those questions relating to first the activities, the outputs, the impact, and we are going to see a few examples of those. So The sources, like we have already said, the sources of these evaluation questions can be from the logic model itself. We can have the stakeholders also developing these evaluation questions to ask themselves whether we did well or did not do well. Previous programs can also be able to provide us with evaluation questions because, like we said in the previous session, you are not going to be the first person to put in place a nutrition program. Other people could have put this program, okay, could have put in place this program. So you need to always read through their literature, read through their data, and see what kind of questions they ask themselves, okay. So this can also be a very good source of evaluation questions. And then the team that is on the M&E side, or the monitoring and evaluation team, will also be a source, or will be able to develop some evaluation questions. So here is the logic model, and how here is the way we can use the logic model to come up with those evaluation questions. So like you see, it is inverted, and some words might not be very clear, but I'm going to try to read for you some of those. So we are trying to link each component of the logical model and an appropriate question that we can ask to ascertain whether the program did well or did not. And this is why we are calling it an evaluation question. So when we look at the resources which were at the bottom, which are the springboard or the foundation of this program, we ask questions like what funding, what personnel, what space or materials were provided for the initiative. Okay, so if we are good, if we are going to see whether our program worked or did not, and why it didn't, and or why it did work well. So we need to first look at the bottom or at the foundation. What materials did we use? So we can always ask those questions and know, were those materials really what suited that kind of activity? Okay, were the personnel that were used to put in place this activity really qualified? So that is why we, in terms of inputs, we also need to ask ourselves those questions. What kind of personnel, what kind of funding did we receive? Was it enough or not? Then from there, we ask ourselves questions relating to the activity. Yes, now you received, you use these inputs or resources, but uh, if we are going to do that training or that health education, we need to know what training activities were carried out. What specific training activities were carried out? An example could be in the field of sanitation, where you need to do hand washing. So if I came to you right now and I started telling you about hand washing, how you do it, how you rub your fingers, how you interlock your fingers, it is not so clear. Okay, it doesn't come out as well as a person who demonstrates it or shows you a video on how it is done. So that is why we need to also ask ourselves those questions about what kind of training activities were carried out, okay, in terms of activities. Remember, we are trying to evaluate the success of our of our program. So we need to ask if our program did well. We need to know those things that made it do well, so that in future all the other future programs can always use some of those techniques. Okay, if it didn't do well, then we need to know what things or what activities could have been done and they were not relevant or caused the failure of this program. Okay, then in outputs, of course, there are many activities and relevant questions there. But now in outputs, we want to know uh, from that activity of training, how many individuals participated. Okay, we need to know how many individuals participated in this training. Okay, that is another evaluation question, and it is evaluating the output bit, because like I said, from an activity we generate an output. So when we are asking ourselves these evaluation questions, we evaluate at each level how many people participated, because you cannot be targeting 300 people to participate in this activity and then you get 10, then your program fails, and then you expect and then you do not ask yourself such a question. Okay, so if your program fails, then you need to know that you need to understand from such a question that maybe the people who participated were fewer than what should have been the ideal number. Then from outputs, we ask ourselves the questions relating to outcomes. What knowledge or what attitude, what skill, or change in behavior occurred in the participants who were exposed to the activities, okay, or to the initiative. So in the outcome, we now want to know, did there happen, or was there a behavior change amongst those people who attended that activity, and what could that change be? Okay, so that is how we ask ourselves those questions. And when you get these notes, you're going to see other questions here and there, but I wanted us to appreciate that we can better understand or ask these evaluation questions if we are in terms with these components of the logical model. Okay, if we know the resources that we put in, the activities that were that took place from the resources, and then from those activities we got outputs, and we also ask questions about those outputs, and then we go on like that, following the components of the logic model. So the other technique that we can use to put in place these evaluation questions, or questions that enable us to know whether there was success or not of our program, is the nominal technique. And this basically uses it basically uses different stakeholders in selecting evaluation questions. So in this case, you want to involve them in generating the ideas, or these themes that we can ask ourselves on, and then you record them so that everyone is satisfied that their idea has been captured. You discuss them, and you put them in categories. Okay, you say these could be the ones that were well done, and these are the ones which were not well done, which will be the negative and the positive exemplars. So after that, when you have discussed these ideas, then you rank them. Which one was the biggest in terms of being well done? Okay, which one could be the best example of what made our project succeed, and what wasn't done well and could be improved. So when you rank the two from the positive and the negative, you should be able to come out with some of those evaluation questions. But again, I would encourage us to use these questions from the logic model, which are a bit very straightforward. Then from that, after we've developed these evaluation questions, we need to also appreciate what program indicators mean, because it's from these program indicators that we are able to measure our progress, that we are able to monitor the progress even before the program ends, that we are able to to evaluate at the end of the program or periodically whether the program did well or did not. Okay, and these indicators are always at also each step of that logic model. So at activity level, you have indicators. At output level, you should be having indicators. The same applies to the output level and the outcome level. So if we are looking at, for example, the health education, what could be an indicator that this health education took place? So the indicator there could be the number of people who attended that health education activity. Okay, so that number of people can be measured, and it will be able to tell you that this activity was positively responded to by the target population or the stakeholders. Okay, so these indicators should be verifiable. Like it shouldn't be what a one person thing who can just set this indicator and you cannot verify it by objectively by use of other people. Okay, or using some other available information. So if you say the number of people who attended this training session or the health education talk, we should be able to verify that number either through use of attendance lists, either through other records that we can be able to access. So these program indicators are better captured if we document all the day-to-day activities, the minutes, the expenditure, and work plan is in place. So if we do that, we are able to come out with these program indicators, which allow us to always capture those changes that occur due to the intervention and help us to measure progress or success and failure in our program. So then as we measure all this, we should be able to appreciate that there are things that require us to think out of the box. For example, measuring concepts and constructs which cannot be easily quantifiable. Now you have to use techniques like qualitative data collection methods. Okay, so measuring things like individual knowledge, attitude, practices might not be easy, but of course it can be done. For example, if you're talking about the knowledge that was gained from that health education talk, how can you really measure it? It might be challenging, but it can be done. So there are those Likert scale questions which are always asked, and they could really help you to assess whether the person gained knowledge or did not, whether the person has a better attitude or a poor attitude towards this program, whether the practices have changed or not. So we are going to be seeing how some of those questionnaires assess these constructs and concepts which are not easy to measure can be put in place, and then we can find a way of measuring them. The other things at interpersonal level could be peer or family influence, which is also a bit tough to measure. Transportation and its influence on utilization of a program or will also be a bit problematic, but it can also be measured. And then at organizational level, we look at things like organizational norms, practices, individuals' ability to access services within the institution. Those policies are also not very easy to measure, but with appropriate qualitative data collection techniques and analysis techniques, of course, after you've collected this data in a qualitative way, then we can be able to get or to better understand some of these constructs and concepts. So we are going to look at this in length, of course, when we look at those data collection methods, and then we can really appreciate what I'm talking about here. But rest assured, of course, those are the things that we need to always measure in our communities, in our project target population, so that we can really capture everything, and it will help us in our monitoring and evaluation. Then for us to evaluate the success of our project, we need to design we need to design appropriate techniques to do so. So we can have observational or experimental studies, which basically always divide these groups into two. From the start, you can have your target population, and then another population which looks like your target population, but is not in maybe in that area, or it could be in that area, but you choose to give one group your intervention, and then another you do not give it that intervention, and then you try to monitor, or when you're doing this evaluation, you evaluate whether there was significant change in this group that took on your intervention. So you want to see whether your intervention is of a positive result or it is not. Okay. So for example, if I have if I'm implementing a project in town X in in South Sudan, and then it is about reducing stunting, and then I supply this town X with with food rations that could reduce this stunting. So I can also take this another intervention, or I can also monitor what is taking place in town Y, which did not receive these food rations, to see whether indeed these food rations are able to reduce this stunting in town X, and then the town Y, which is also having the similar characteristics with town X, there is still stunting at the end of the day. So this is what we do in trying to evaluate, or in evaluation research of our programs. And then we can have these control and comparison populations, which really try to bring out that causation and effect scenario. What is the cause and then the effect of a particular situation, and these are common in diseases. So then we also have quasi-experimental evaluation design. So this one is might also be having two groups, like that town X and Y, but in this case, people are not randomly selected. Okay, so you really you do not randomly select who to take place in this design or this evaluation design. So it is basically on the will of these people who would want to take place. And you can, the best example could be like in a hospital setting, whereby you want to give one drug that is being tested to certain people. So you can take this drug to the hospital setting, and you ask people who would want to remain on the old drug. If, for example, this drug is treating malaria, and the people have been taking artemisinin combination therapy, or Coartem per se, so now you want to bring in this drug Z. So you want to ask these people if they are willing to take on this drug Z and leave the other old drug. So there, of course, it is not randomized. Okay, so someone will choose to take on your drug or not. So that is how it is a bit different from these experiment or observational design. So the other designs that are used for evaluation could be single sample design, and in this case, you just look at the people who benefited from the program. If I put in place my nutrition program and it is time to evaluate, I do not have to go to the other town Y, which we did not receive those food rations. I only focus on these town X people to see whether the intervention worked or did not. Those food rations that were introduced, did they reduce the stunting that was in that town or not? So in this case, we are looking at that single sample design, and we are looking at the people who benefited from the program without comparing them with the other people who did not benefit, or the control group. Then in time series, it is used to check the sustainability of intervention effects, and basically takes place periodically. It could be over 1 year, over 3 years, over 5 years, So you keep on making these evaluations over time to check if there is a sustainability of an intervention effect. So if you put in place these food rations, if people were taught on how to grow and if people were taught on how to grow those foods which are nutritious, are they able to still grow those foods even after your program has stopped? So you keep on checking, and this is what we are calling the time series, where you are trying to check the sustainability of the intervention effect, because you do not want to leave all your program stopping and then they also stop at that. You need something that will be sustainable. Okay, yeah. So there is always a story of people who are having a community, or who are living in a community that was practicing open defecation, which is not good for public health, and then a program came in and built for them those toilets and latrines. So the program was there, and it was encouraging people to go to these toilets and always use them consistently. But when the program stopped and thought that it was all well, the people stopped using these toilets. They abandoned them. Okay, so at the end of the day, this community went back to their earlier practices, and the diseases, of course, came in after this program had gone. So that means that they did not look at how to make this program, or this thing of ending open defecation in that community, how it can be sustained. They did not put in place those measures to make it sustainable. But it is through those measurements that they were able to know that their program was not sustainable. So perhaps they did this time series. Then inefficiency assessments, which is also part of how we can evaluate the success of a program. We look at things like cost benefit analysis, cost effective analysis. And like I said in the first session, when we talk about efficiency, we want to look at what cost was that program really was that program implemented. Yes, the program was supposed to reduce stunting or reduce malnutrition among under 5 children. Yes, it did reduce that malnutrition, but at what cost? Okay, because treating malnutrition of one child could be, for example, $100. So if you're going to put in place a program that spends on a child $500 or even more, then this program will not be deemed efficient. Okay, yes, you have treated this malnutrition, but at what cost? So you should be putting in place that program that reduces that people are able to wear with the treatment the treatment of malnutrition is $100. For me to get rid of malnutrition in my child, I need $100. and then your program is saying that your program is saying that for us we can put in place a measure that will help you to reduce this malnutrition or prevent this malnutrition, but we are going to spend $500, then that one is not efficient. I need a program which will prevent this malnutrition at a cost of like $50. You see? So this is what we are talking about. So when you're evaluating the efficiency, or when you're doing these efficiency assessments, you want to ask yourself such questions. Yes, the program is going on, or the program was completed, but at what cost did it meet those set objectives? Okay, that is what we are looking at, and we use such techniques as cost benefit analysis, cost effective analysis, but they are all trying to look at how efficiency was achieved. And efficiency, you are looking at the cost of that of that intervention. The intervention could have been good, but it was very costly. And I gave you the other example of a country in East Africa which built a very good road, which people marvel at. People are very happy that they constructed a good road, but each kilometer costed the country $1 million. So it is a good road, yes, it achieves effectiveness, but the efficiency is low. Okay, so we try to do that when we are doing that evaluation bit. Then the data for efficiency assessment can be got from administrative expenditure reports, the direct cost reports, unintended costs. So these often are neglected, but when you unearth such reports, or the costs of unintended expenses, direct expenses, those administrative expenses, you're able to really factor in that cost bit and relate it with the benefit of this program. And going on with how we can evaluate or do evaluation, we can also use a technique called internal validity. And internal validity is looking at the extent to which an effect is observed was caused by systematically planned intervention or your program. In other words, we are saying that at the end of the day, if we are looking at stunting, reducing, for us to say that your intervention was really good and it achieved its goal, then we want to say that this stunting could not have reduced by this measure if your program or your intervention that was systematically planned was not in place. So if your program was not in place, we shouldn't achieve that effect. Okay, so you do not want to be evaluating something and you find out that even if this program was not in place, we would have achieved this this kind of effect anyway. So, of course, as the world evolves, there are always those changes that occur naturally. So it shouldn't be a natural change. Okay, the effect of your program shouldn't be more of a natural change. It should be that if your program or that systematically planned intervention was not there, the effect would not have occurred. So that is what we call internal validity. Then we can also evaluate our programs using or testing for these errors, type 1 error or type 2 error. And in type 1 error, we are saying that you could be saying that there is that there was a positive change, and yet the positive change wasn't there. And then in type 2 error, you could be saying that there wasn't a good change, or the change wasn't there at all, or the effect was negative, and yet there is a positive change. Okay, so the illustration is showing in type 1 that in type 1 error, you have a man being confirmed as positive to be pregnant, and yet a man physiologically is not supposed to be pregnant. And then a lady who is visibly pregnant is told by a doctor or a medic that they are not pregnant. So that would be a false negative. So when we are evaluating these programs, we often make such errors. Okay, so we need to always eliminate such errors when we are doing this evaluation. We are going to see how these errors also take place in our researches when we are trying to collect this data that helps us to monitor and evaluate these programs. And that's when we shall better appreciate such errors. So the factors that influence evaluation conclusion. Yes, now you have done the evaluation. So how do you conclude, and what are you going to say was the effect of the program? Okay, so a lot of factors can affect this conclusion or your evaluation conclusion, and they include attrition, history, and the others. So we are going to look at each of them. So in attrition, we look at the fact that if you're having town X that was composed of 200 members, then town Y was composed of also maybe 200 members, you gave town X your intervention, or you gave them those food nutrients to prevent stunting, but in town Y they were not given the same, or they were given something else that doesn't focus on stunting. So at the end of the day, when you are evaluating the effect in these two towns, there could be factors that could influence your overall or that evaluation conclusion. So if there is loss of participants, like 50 people die from this town X where you gave your intervention, but in the other town Y, all the people are present, or like 5 people are the ones who died, or it could be death, or they shifted maybe to another area. So if you have loss of those participants, you are not going to really come out with that definitive evaluation conclusion that can be used to gauge whether your program did well or did not. Okay, so that is what we call the attrition. Okay, so basically you would want in an ideal situation, either if you lose 50, even the other side there should be a mechanism that now you track only 150 out of the 200. Okay, so that you can always have those balanced situations. Okay, then there could be history events that take place outside the intervention will also affect measurement of changes. And for example, if there is a war and it takes place in the other town Y and doesn't take place in town X, or the town X is not affected by that war, so such events, of course, will also result in these problems of that affect the evaluation control. Or there could be politicians. You gave food rations to this town X, and then politicians gave, who are not related to your program, gave food rations which are maybe close to what you gave to also town Y. Okay, so town Y got basically something that is almost the same as what you gave to town X. So at the end of the day, you are going to see improvement of nutrition in this town Y, and yet it was caused by something that is different. Those other events that are not related to your program. Then we have instrumentation. What tools are you using to measure this evaluation is also going to affect the evaluation program. There could be changes in the study participants themselves, whereby you started with little kids, they are now adults. Of course, when you are now measuring, if you have not been doing it uh, in a timely manner, or you have not been monitoring these people time and again, then it will be hard for you to make a very sound evaluation conclusion. We have things like a selection, uh, how people select to be in these different groups, or sometimes people crossing over from town X, now they cross to town Y. Such things that you cannot control will also influence or affect your evaluation conclusion. Then, before, remember, there is this point of regression, and wanted us to relate it to the fact that before we even put in place this program, we always have that baseline score. Okay, if you are going to implement this nutrition program, you need to know how many people are having malnutrition. So that will be like your baseline score. So at the end of the day, when you are evaluating, you want to know how many people were able to go beyond that score. Okay, so that they cross over to good nutrition. Okay, so the fact that whenever you're doing your post test or after your program, that these values tend to come close to the population mean, or the mean value of this baseline score, is always also a factor that influences or affects our results when we are doing evaluation. Then we could commit errors like the ones that we saw the other time, of type 1 error, type 2 errors. Sometimes we could have a sample size which is too small, and if the sample size is too small, then we cannot use it to generalize on the bigger population. Okay, so you cannot be looking at the nutrition status of, for example, a population which is like 1 million, and you use only 100 people, and you want to use these 100 people to generalize and say that if these 100 people uh, have now become well and are not stunting, then that means that the whole population is now not stunting. No, that is a very small sample for you to use to generalize on the larger population. So it is also a very big factor. And then we look at another factor called testing. So in this case, changes that occur to the study participants when a test is given before the intervention may affect the results when the test is given again after the intervention. And this is because the participants now tend to get familiar with these test items. Okay, so if you give if you give these participants the same questionnaire that you want to administer to them after the program, then now they might try to remember what they answered in the other questionnaire before the program, and then they will repeat the same answers. So that will influence or will affect your evaluation conclusion. So we always need to anticipate all these factors so that we can always put in place measures to prevent them. Okay, so like in this case, you want to design you want to design different kind of those tests so that the one which is administered before is different from the one which is administered after. They could be related but a bit different. So that is why we need to know these factors. Then, as we conclude, we need to know that even when we do randomization, uh, even when we choose these samples or the people to participate in our intervention randomly, there are some things that we cannot solve. Like I said, in town X or in town Y, you're not going to use to implement your intervention on all people, but you can use a few people in town X or a representative sample in town X and then a representative sample in town Y. But when you're choosing these people, of course, you randomly choose them. You do not want to choose when you are biased. So we are going to look at those techniques of randomization. But the simplest would be like simple random sampling, where you maybe put in place what we call a lottery, and you write yes or no, and then the yeses are equivalent to the sample that you need, and then after that, the people who choose yes are the ones who are going to participate. Those who choose no are not going to participate. So there, of course, everyone has they all have an equal chance of participating or not participating, because it is just probability. But at the end of the day, we have issues that even when you do this randomization, there are some issues that always come in place. And one of them is diffusion and imitation. And in this case, you have information crossing over from the treatment site to the control group. So in our example, town X is the one which is receiving, for example, the treatment, is the one which has been given the nutrient food or the nutritious food to eliminate stunting. Then town Y hasn't received this nutritious food. So if information crosses over and the people of town Y also know that the people of town X are receiving nutritious food, there could always be a problem there, okay? So people can try to either get themselves some nutritious food or get either buy that nutritious food or something close to that, or get it from the neighbors, okay? So when that happens, of course, the difference between the treatment and the control group is always narrowed. Like people, you would expect that in town X there will not be stunting, and then in town Y the stunting will persist because they were not given that nutritious food. But if they access information and then they are able to buy some nutritious food for themselves, of course, that gap that you wanted to portray will no longer be there. Okay, so that difference will be narrowed, is what we are trying to say in diffusion and imitation. Then compensatory equalization occurs when the control group is provided obtains alternative intervention that results in narrowing the differences. So it's basically almost the same as the other one. And in this case, it could be that, like we said in an example earlier on, that you give food rations or this nutritious food to town X, and then the town Y people also receive almost the same thing from a politician or or someone or a good Samaritan who is giving out food. Okay, so in that case, of course, there will be now that compensatory equalization. People will want also be taking that nutritious food and stopping that stunting. Okay, Then compensatory rivalry as another limitation of randomization is that it will occur when the control group is provided or obtains no sorry in compensatory rivalry we see that the control group works hard to rival the intervention group to improve their outcome. So such rivalry minimizes ultimately the differences between the group. So again, it is all about the information exchange. So if the other people in the control group or the group that wasn't exposed to your intervention get to know about the other people or see the changes in them, they will be able to rival them, they will be able to put in place or work hard to 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 basically also look like the other people in the control in the test group or the group that was exposed to your intervention. And when this is done, of course, you will have what we call compensatory rivalry, and it will minimize the difference between the two groups. Then lastly, we have external validity. And in this case, we are looking at the extent to which the observed outcome can be generalized to other times, settings, and population. And for you to achieve this external validity, you need to have a population that is that is that has that is not just homogeneous or that has a lot of characteristics. Okay, so you need to have a population that has children, the elderly, the young adults, the PWDs, the women. Everyone should be represented in this what we call the heterogeneous population. And then your sample should be large enough, because for you to generalize what you have found out from this evaluation, you need to make sure that it depicts the picture in the other big population or the target population or your study population in this case. So you do this when you have a sample that contains all these people represented, which you are calling the heterogeneous population, but the sample itself should be large enough so that it can be used to infer or to generalize on the larger population. So you cannot evaluate that you cannot conclude that there has been nutritional change or people have no longer stunting or experiencing stunting and have better nutrition status when you have a small sample. Like I said, you cannot have 100 and you use it to infer to the people to the general population, which is 1 million. That is a very small sample. And again, you cannot use only children to 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 infer to the total population or the larger population when you are talking about a nutritional status that is supposed to generalize the whole population. So you need that heterogeneous population of all the people that are which should be representative. Everyone should be represented in this case. So that is how we are going to do evaluation. And after that evaluation, we can really know if if our program did well or did not do well. But we start from designing it very well using that logical model, and then from that we can develop some questions to see how we do this evaluation. From that we can see how to do it, how we can get problems here and there, and then the factors that will influence that evaluation conclusion or that final say in terms of our evaluation. So that is it for today, and I think it has been too much from me and less from you. So it is at this point that I should welcome a few questions, if we have any. Samuel Ador is already raising his hand. Can we have their question?
Yeah, thank you so much. I'm raising is the same like the question for yesterday, but will it be possible if our admin can share this very beautiful note through our email so that we can download and then we frame?
Yes, I think Mr. Samuel